Joining us now, former CDC Director Dr. Robert Redfield. We'll get to bird flu in a moment. Doc, nice to see you. Well, let's start with these measles outbreaks. Texas health data shows measles vaccine exemptions have gone up dramatically, specifically in Gaines County. By the way, for our viewers, as you know, this is the epicenter of the current outbreak. Is that why we're seeing so many cases in that area, because so many people are not vaccinated?
Yes, I think that if you look at that area, the overall vaccine rate of the population is about 80%. And we normally know for herd immunity for measles, it's got to be about 93%. And so when you look at a lot of the kids that are going to school, I was looking at it in some of those districts, about 40 to 50% of those kids have religious exemptions. So there's a real under-immunization in that area.
We're seeing another outbreak, like I mentioned, in New Mexico. Should we be concerned about the spread of measles and how quickly we're seeing it?
Well, the best thing we can do for measles is obviously is to be vaccinated. So many of us have already been vaccinated. Young people, it's really important that they get vaccinated. As you mentioned, most of the cases that have occurred in Texas and New Mexico are among unvaccinated individuals. I'd like to stress that the measles, mumps, rubella vaccine is a safe vaccine. It's highly effective in preventing measles. People don't realize that when you do get measles, a significant number of those children can actually go on to develop pneumonia, and some of them can go on to develop encephalitis. And if you look globally, it still is a major cause of death of children. So the best way we can protect ourselves with measles is to get vaccinated. And if you're vaccinated, you're really protected largely against measles.
Sorry, I also want to ask you about the bird flu. You said just this week that COVID, and I want to read the quote, is a minor epidemic compared to the epidemic that's coming, which is a bird flu pandemic. Can you elaborate?
Yeah, I've always felt that the bird flu will be the great pandemic, and that's why I've referred to COVID as the minor pandemic. When I chose to go into CDC, my wife and I prayed about it, and I decided to say yes, because I had a premonition that our nation was going to have a major respiratory epidemic. I thought it was going to be a bird flu pandemic. It turned out to be COVID. But we are at risk for really a very significant epidemic in bird flu. We now have over 150 million birds infected in our nation. It's now in over 48 different mammal species. We've had 68 cases in humans. The virus still hasn't learned how to go human to human. But if it learns how to go human to human, we're going to have a problem. And I think eventually it will. In mammal to mammal, it hasn't learned how to go mammal to mammal. So when it gets into a dolphin or a dog or a cat, it sort of doesn't go dog to dog or cat to cat. But there was one exception in Argentina recently. It got into seals, and it did learn how to go seal to seal, and they had a huge seal die off. So I think it's a real threat, and I think we ought to get prepared. And I think the best way for us to get prepared is to have an aggressive, like warp speed like program, not for a vaccine, because flu vaccines, while they're important, they don't work that well about 50% of the time. We really have to develop an aggressive program in antiviral drug development, so we have treatment for people when and if they do get infected.
There are actually reports of a seal in Massachusetts that has the measles, so I'm glad you mentioned that. Today, the president about to do something about eggs after, of course, the administration this week said it's changing its strategy on bird flu, potentially, to your point, focusing on vaccinations and biosecurity versus killing infected flocks like we've been seeing for the last few months. Do you think that'll be enough?
Well, I think the culling concept is not the way to manage this in the chicken industry, where you just line them up and you just kill them all. I think vaccines is an approach. I don't think it's going to be successful in being able to protect most of the birds. That's why I go back to the idea of antiviral chemoprophylaxis. If we could develop antivirals, which I think we can, that could prevent the birds from getting infected, or we could develop antivirals that could successfully treat the birds so you don't have to kill the birds. I think that's a much better strategy than just saying, okay, we're going to kill all the chickens. And I hope that's what happens. We develop really an aggressive program to develop antivirals for both humans and obviously for veterinary use. But again, we can also in parallel develop vaccines.
Thanks so much for watching. Go to joinnn.com to find NewsNation on your television provider. And don't forget to click the red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.